What do you do when you feel like you can't be helped? When you're suffering from a health condition or a diagnosis that likely has been around for a while and you've seen many doctors and frankly you're hopeless. What do you do at that point? I'm going to make the case today that that's when we should return to fundamentals. If we've strayed away from them, we should return to them, because fundamentals are principles, or the baseline things that everything else is built upon, the foundation. And so if we're hopeless and can't be helped, or we've seen many doctors, or we don't have access to doctors, then what can we do to give ourselves some hope, create some momentum, and hopefully restore our quality of life? That's what the topic is today. And I'm covering this topic because I've had quite a few long COVID cases and consultations lately, and I've seen success with it. And I believe that the success comes from the functional medicine paradigm that I practice, which is every case is a person and every person is an individual. So rather than, approaching the person complaining of long COVID as long COVID and ignoring everything else, I approach the person as Joan. And the long COVID is interesting, but that is not occurring in Joan separate from the rest of Joan's lifestyle and Joan's physiology. So whereas the other 5 doctors she's seen first perhaps just saw long COVID and tried to address that, the secret sauce is addressing Joan, because again, the long COVID is not happening in exclusion to everything else in her life and physiology. So we need to look at all the potential sticks and the spokes, because those things could influence the outcome in a positive or negative way. And so let's talk about this case, which came across my desk today. And this is a 27-year-old female that has long COVID, or at least has been diagnosed with long COVID, and is everyone in her life is saying that it's been long COVID that has made the past 2.5 years hell for her and hell for her parents. Well, why for her parents? Well, because she went from being a 24-year-old healthy, active, normal female to contracting COVID, making a full recovery from the initial COVID infection, but then having long COVID symptoms since. And since that has set in, she's had to move back in with her parents. She's basically lived in a dark room, her mom says, and she's got photophobia and phonophobia. So essentially she's light and sound sensitive. So she has to be in this blacked out room all day long. She's just laying in her bed on her back, her mom says. She's got a constant migraine 24/7. She has severe insomnia, which her mom related as if she gets any sleep, it's very little at night. And so she's up all the time. And we've talked about sleep deprivation and insomnia in the past, and how if you're trying to heal and you're not sleeping, that's really not good. It's disadvantageous if the goal is healing. So there's the severe insomnia. She's also got poor balance and arm weakness. And so this adds up to her having to text her mom when she has to go to the bathroom, and her mom has to come walk her to the bathroom and walk her back. She can't use a walker because her arms are too weak to hold herself up. So she's got the leg strength, but she has poor balance, so she can't walk there on her own, and she can't use a walker because she doesn't have the arm strength to balance herself with a walker and get to the bathroom on her own. So life is just hell. She's also suffering from GI symptoms that come and go, so it's not all the time. They're hit or miss. And she's seen many doctors. She's seen functional medicine doctors. She's gone to the Amen Clinic in Atlanta. She's seen neurologists. She's done all the, sexy treatments. The functional medicine clinic she saw gave her IV therapies with Myers cocktails and magnesium and blood ozone infusions. None of that was helpful. At the Amen Clinic, they were treating her for mast cell activation syndrome, with a bunch of antihistamine medications and other medications. She was trying that, but had to stop the medications because they hurt her stomach. She's seen a neurologist for Botox injections for the migraines. The Botox injections aren't helping the migraines. She has seen other practitioners that found that she has an MTHFR SNP, a homozygous SNP, which is the worst kind, and they've supposedly treated that, and that didn't help. So she's, in her mind, tried everything and nothing's helped. So she's not even open to seeing another doctor. And so her mom is obviously sad because she's got a great mom who's advocating for her hard, and her mom wants her to come see me. And she's, the mom's basically doing the call to get information in the hopes that at some point her daughter would come around and be open to seeing another doctor and come to see me. And whether or not that ever happens, I gave the mom this information because hopefully, whether she sees me or goes to some other doctor, she's going to need to heal enough to be able to physically go, right? Because just going to a doctor's visit wipes her out. Why? Well, her mom's got to essentially walk her there. She's sensitive to light and sound. So you're not going to an office with lights off and no sound, right? Plus she has to be in the car and all of that. So her life has really been turned upside down. Now, one question I asked mom was, is she eating? And mom said she does eat, and she eats pretty decently, mom said, and that, nobody knows what that really means, but she says she's eating enough to at least not be losing weight. So that's good because, hey, she can stomach things. And the reason I asked that is because mom had mentioned when she went to the Amen clinic and she saw other doctors that gave her other medications or supplements, she would start care, but then stop because the treatment, whether it's supplements or medications, ends up hurting her stomach. And so my thought was, I wonder, is she eating? Because if you're not eating, but you're taking in medicines or supplements, no wonder that's irritating the GI tract. And then also the question would be, is she digesting and assimilating those treatments at all? Because she could be on the best medication in the world or the best supplement in the world, but if she's not digesting and assimilating it, we're not getting the intended benefit. And if she weren't eating, then the first step would be, let's back up and just get her eating. Let's get some food in, so then we can pair that medication or that supplement with food, if it is one that needs to be paired with food. And if it is, we need to pair it with the food to get the best result. So this woman is pretty hopeless. Her mom is not giving up. Her mom is hoping that she'll come around and give other offices or other strategies a try. But how do we do that? How do we get her there? How can she get to the point where she can go to another office? How can she be helped, right? Can we shine some light in that dark room? Can we draw her towards the light? And so the way to do that I related to her mom was a plant metaphor. We need to return to the fundamentals. We need to leverage principles. When you're hopeless, return to your fundamentals, return to the principles. And so the fundamentals of health are light, soil, water, air, right? If she was a plant, we need to get her those 4 things. And in a dark room, she is eating, so she's getting some soil, metaphorically. She can drink water, so she's getting water, but the air is pretty stagnant, and the light, she's not getting any light. So if that plant survives on soil and water, it's going to be an unhealthy plant if it survives at all, right? So we need to get this plant to be healthy, or this human to be healthy, because humans need light, soil, water, and air too. Light is the sun. So we need her to get out into the sunlight. Why is that important? Well, we've made multiple videos about the health of the sun. The most obvious to most people is vitamin D. If she's been trapped in imprisoned in a dark room, her vitamin D level probably is not good. So we need that from the sun, but the sun also provides near infrared light. We've talked in previous videos about the importance of near infrared light and for energy production and the immune system and all kinds of different physiologic processes. So getting out in the sun is a goal. Soil, her mom said she can eat. That's good. We want her eating. And then as she's eating, we want to seek to dial in the food intake to healthy foods and hopefully get some variety in there too. Healthy foods for obvious reasons. We want healthy foods to become a healthy body, and variety because the various microbiota, the oral microbiome, the gut microbiome, different bugs like different foods. So if you're not eating variety, you're selecting for a biased microbiome. If you're eating variety, you'll have a more diverse microbiome, and diversity is healthy in terms of a microbiome or microbiota in the gut and or mouth. Water. She can drink water. Is she getting enough? What's her body weight? Is she getting half her body weight in ounces at minimum each day? If not, we want to meet that milestone. And then air. We want her, again, outside in the air getting oxygen. And, clean oxygen relative to a dark room, right? And so there's many studies showing the importance of being out in nature and in green spaces and getting air. There's a concept in the research called forest bathing, where just being out in nature in the green, the green trees and bushes and grasses, they reflect near infrared light much more than urban buildings and pavements. So she can improve her infrared light intake by being in green spaces. Green spaces produce more oxygen. Oxygen obviously becomes energy for us, but oxygen also supports the immune system because your natural killer cells mature along an oxygen gradient. So the more oxygenated you are, the healthier and more robust your natural killer cells are, the better your antiviral defenses and anti-tumor defenses. But relevant to this long COVID case example, the antiviral defenses are relevant. Also, we've made multiple videos on grounding, the importance of grounding. So getting out in the air and in the light, if she can walk in the grass or just sit in the grass, barefooted, bare-legged, getting bare skin touching the grass, now she's grounding herself. And grounding lowers stress levels, improves blood viscosity, improves blood pressure, does all kinds of things for us, improves pH. So these are all things that are absolutely free. If we can get her to implement these fundamentals at an optimal level, then perhaps stacking days together of doing all four of these things correctly will create some momentum for her and allow her to feel better. And perhaps she is a little less sensitive to light and sound. Perhaps she gains strength so she can walk on her own and balance. Perhaps she has less headaches. If we can get some symptomatic improvement and get her to tolerate the world again, then that may be enough for her to get to a doctor's office and have the chance to improve even further and build upon these foundational activities. So we're all in our society looking for the next hack, right? The biohack or the next magic bullet supplement or whatever it is. And we commonly forget about the fundamentals. I communicate a lot to patients, hey, do the easy hard thing or the hardest easy thing, which is just get the right amount of water for you each day. Many of us don't do that, right? But we're willing to watch an infomercial and buy the latest antioxidant from the rainforest, right? But if we would just nail our fundamentals, we may not be up late watching infomercials because we'd be healthier. Okay, so let's remember to do the easy hard things, and that can save us a lot of pain down the road or right away. So if you're someone out there with long COVID or you know someone with long COVID, and it doesn't even have to be long COVID. It could be multiple sclerosis. It could be any chronic issue that you're suffering with, that you've seen multiple doctors and you are in your literal or figurative imprisoned dark room and you need help. A, return to the fundamentals, and then B, when you're good enough to be able to get back to that doctor's visit, seek out a doctor that can do the detective work to help you figure out what are the different sticks in the spokes in your case that need to be addressed, or what are the fundamentals that how do we need to build upon the fundamentals that you've instituted that have allowed you to get back into a doctor's office. And on my YouTube channel, there's a couple testimonial videos of previous long COVID patients that have been able to get their lives back. And there's testimonial videos from many other patients with all kinds of different chronic illnesses that have got their lives back. So thank you for listening to this. And remember, if you're losing hope, don't give up. Return to the fundamentals. Am I doing the easy things correctly? If not, tune up those easy things. And then hopefully that builds enough momentum for you to be able to get to the next place you need to be to add the next layer of improvement.
So I don't have a question, but my story, I mean, is very similar, but not with COVID. Mm-hmm. So, I mean, I was diagnosed with severe lupus at age 21, in the hospital over 30 times. I've lost track, to the point where it's, you know, I'm going to live the rest of my life with this chronic degenerative disease and can't take care of a child. I can't have any fun. I can't, you know, get off the couch. But I never gave up. And every time I feel like, oh, this is the way I'm going to feel the rest of my life, something new comes along. It's just one more piece of the puzzle. And you're my current piece of the puzzle. And I've said this before, but, you know, with you, you know, I had my first negative ANA, which is a standard, you know, typical lupus test in 35, 36 years. So it's just, you know, one step at a time, like you said, start with the easy things. And that, you know, and then you feel just a tiny bit better, and then you can do the next easy thing. And it's just building. You're not going to get better overnight. I'm still fighting the chronic illness after 36 years. And I do get to those points where I want to give up and say, okay, I'm done. I'm tired, you know, and this is the way I'm going to feel the rest of my life. But so far I haven't given up. And it's just a part of my life now. And I want to get to that point where I feel like I can do anything I want. So, you know, just hang in there and it will get better.
Thank you for sharing that and being open for people to hear your real case. And thank you for the continued opportunity to work with you. As long as you don't give up, you can't lose, right?
Right. Right. And some things don't work. Some things work good. Some things you're like, well, I don't feel any different. But slowly, I mean, the changes can be so minute that you can't feel a change right away, but they're there. And then 6 months later, you're like, you think back of how you were, and it's like, wow, there was a change for the better. So it's not going to be give yourself a pill and a quick fix. You just got to be in it for the long haul.
Yeah. And it's a journey, not a destination, right?
That's right. Mm-hmm. Absolutely.